tell I don't take this off too often. All right, here we go. Okay, so let me explain a couple of things before I begin. I have what we call the BD Easy Scrub, and this is the Hippocleans, all right, and I'll explain a little bit of this in a second. And this one is also the BD Easy Scrub, but you can see it's a little darker because it has povidone iodine. So if you're allergic to iodine or shellfish, you're not going to want to use this to scrub, you're going to want to use this, okay? But because I want each of you to practice, and this is right here just going to be for demonstration, but you would use this in the field, I'm going to show you with these sponges, okay? And mimic the same thing, but just using that one. So first let me explain what this is. This is a Hippocleans sponge, and you can see right here it has the nail pick, right? So that's the first thing I need to do is address my fingernails. I'm going to take this out, but we wouldn't take it out just so you can see. On this side you can see it has the little brushes, and on this side it has the sponge. What's in here is antimicrobial agents, okay? So it's going to free you from pathogens a little more than if you just do a regular medical aseptic hand wash, okay? So what we would do, if we had a new pack, all right, we would open a pack, and what we're going to do is we're going to wet our fingers. But I'm going to demonstrate here before I go over to the sink. And when I wet my fingers, now many of you probably have seen a lot of the medical shows like Grey's Anatomy and so forth, and you never see them really do this. Why? Because Hollywood is not going to pay anyone you know, to do a 10-minute surgical scrub when they can get all the action and all the other drama that they can do, right? But we have to do it because we're in the healthcare field. So when I rinse my fingers, I need to make sure that my fingers are stretched out, right, to get everywhere, to make sure the water is addressed. I'm going to make sure my palm is facing me, so just imagine if the sink is in front of me, and I'm going to go doing this motion here, and then go up. Palm still facing me, okay? Next, I'm going to do the same thing and go up, okay? So it probably will require, you know, it's going to cause a little bit of mess, which is why I put a little bit of the paper down, okay? And if I don't get it all wet, do the same thing, okay? If I have to do it 2 or 3 times. What's important is that you don't have your hand down. Why? Because you don't want the water to run back down to your hands and contaminate, even though you haven't addressed the areas yet. So go through, okay? Then the next thing I'm gonna do, because I have this open, I would have had this wet. And I know it sounds a little strange, but because it's antimicrobial soap, and yes, I am using tap water, it's gonna kill that, but I need to get it wet, right? So I just run it under the water and let it get, fill the water a little bit right here. There's not really a place where you can stop, but just as long as it gets a little wet. Then what I'm gonna do is I'm gonna take my fingertips and kind of just go like that on the sponge. And so now I have a little bit of soap on my fingertips, okay? First thing, as I said, I need to address each of my fingernails. So my palm is always facing me when I'm scrubbing, but when I'm doing the fingertips, I'm just gonna do each fingernail, okay? Every fingernail. What's great about the surgical aseptic hand wash is because I can't touch anything, I get to drop everything in the sink, okay? Somebody else comes behind you and turns the water off because you can't touch anything, correct? So after I have freed my any nail debris underneath my fingernails, then the next thing I'm going to do is I'm going to address the fingernails each, okay, with each side. I remove the debris first, and then I'm going to address. So if I had this sponge, I would take the bristle side, and again, palm is facing me, and I have 3 sides. This side, the top, and this side. This side of the finger, the top, and this side. So I'm going to demonstrate like this. Okay, usually we do it 10 times, okay, but I'm just going to go a little faster so we can get through, okay? Can you see what I'm doing? And you have to do each. Then I do the next hand. So palm facing me. It gets a little awkward, especially if you are right-handed. We usually start with the thumbs on the side, the top, the side, 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 side, top, side. Okay, so again, like 10 times each. After that, I'm no longer going to use the brush side because I've addressed my fingernails. I'm now going to use the sponge side. So again, my palm is going to face me, and I'm going to do this, wash my palm. And I gotta make sure that I'm getting the thumb and all my fingers, okay? So it's facing me when I'm doing that. Palm facing me, okay? Then I'm gonna turn to the back of my hand and get the back of my hand like this, not missing any area. Same thing. I do not do this. I turn my hand, everything is always facing me so I can see what I'm addressing, okay? After I do that, since I've done the palm and the back of the hand, now I'm gonna do the fingers, just like I did with the fingernails. So, the side of the thumb, the top of the thumb, side of the thumb, web space. Side of the finger, top of the finger, side of the finger, web space. And you're gonna keep going on, okay? Get the drift, right? When I'm done, this is the tricky part. Now I've done everything with the palm, the back. I've done each side of the finger, the web space, and I've also done what? My fingertips. So the only thing is left is what? My wrist down to my elbow. So I'm gonna again face my palm toward me, and I'm gonna bring my arm around this way, okay? And what I'm gonna do is I'm gonna go in a circular motion, okay? Like this, and I'll go around this way so you can see, circular motion, like this, going all the way around. And as you can see, I've covered this much surface area, right? So what I do is, because I stopped here, I'm gonna pick up and go around and keep going. So, again, start here, then I'd start here, because that's where I left off. Keep going around, start here, because where I left off, and keep going around, okay? Then, this hand. Again, tricky because I am right-handed, so I've got to come around on this side, circular motion, around this way, okay? This, go around. Where I picked off, or I left off, I'm sorry. And then go all the way around, okay? Now what we're gonna do, we get to drop that in the sink. When I drop that in the sink, I still need to have my fingers apart, and I'm gonna rinse the same way I wet my hands. Fingers are gonna go through, okay? Most times I cannot get all the soap off, but I'm gonna keep my palm up, fingers through, again, and I might have to do that a couple of times, okay? This is where I'm gonna need my first assistant. Who is gonna assist me? My assistant, what I'm gonna ask you to do is you're gonna take this towel, okay? Now, this is not the real towels that we use, but we're simulating. And your job is to make sure that I don't touch this to my scrubs, and you're handing it to me. So you're kind of holding it just like this, all right? So I'm gonna have you hold it like that. And what you're gonna do is you're gonna slap it in my hand, okay? Slap it in my hand, good. And so what I do is I bend over and I'm gonna dry. Now it's okay if I don't address my thumb first, but I'm going to get each finger like this, okay? Because I gotta make sure that I dry everything. If I don't dry, it's gonna be very difficult to put my surgical gloves on. Now, if you notice, my right hand is staying in the same place, but as I'm drying, I'm pat drying. I'm not just, you know, stirring up more skin, right? And then I'm bringing my arm up, okay? And my towel is not touching. Then when I'm done, when this hand is done, I'm gonna take my left hand, and on the same side where my right hand is, come under, and then do the same thing, okay? And go all the way through. So what you'll see is that both of these sides are wet. And then I just drop this to the floor, okay? I'm gonna put this here. First thing we wanna do, before I do the surgical aseptic hand wash, I'm gonna get one of these out. So this is where I have to kind of simulate what we would do. So because I'm not using this one, what you all are going to do is you're going to use this brush. This will be kind of like the brush, brush side, and this will be the sponge side. Okay, so I'm going to use this, and this is what you guys are going to do. I'm also going to have to wet it first and put my own soap on it. But you do understand how you have to use the actual scrub brush, okay? I must don my gown, or not my gown, actually my goggles and my shoe covers. So I've got to put my hair up, because our hair needs to be up. Put my hair bonnet on. And why would I want to do all this? Right, because I'm not going to be able to do this after I do my surgical aseptic hand wash. Put my shoe bonnet on, my shoe covers on. Okay. And I would actually have either a mask with a plastic face shield, or I can use goggles. So I'm going to use goggles. Everything's good. If I have to adjust my goggles or anything like that, my assistant, who is my scrub tech, they're the ones who are going to assist me with that. Okay? So let's get to it.
Am I giving you the towel?
Yep, you're going to hand me the towel in a moment. So I'm going to wet my sponge. Get my soap on it. Just put that there for a second. And what I'm going to do is now I'm going to wet my fingers. Fingers. See how slow I'm going? And I'm going up to make sure that I get it wet. Palm facing me. Fingers again to my elbows. I'm going to go a little faster this time. You see how my hand is facing me? So everything is always dripping down. Now, I also want to make sure that I don't touch any part of the sink, okay? So this is where I would do what? Put my fingertips in there to get them a little sudsy, all right? And I'm going to use this, and now I'm going to show you how I clean my fingers, nails, loosening up any of the debris. Okay, I'm done with that, so I would drop that in the sink. Of course, when you're grabbing that, you're actually going to use the rough side. So now my palm is going to face me, and I'm going to dress each of my fingernails. Palm facing me, one side. Then I'm shortening the time a little bit so we can get through. Now what am I addressing? My palm facing me. Fingers open so I can get everything. Palm facing me. Back of the hand facing me. Back of the hand facing me. All right, now I'm going to address what? My fingers. Side of the thumb, top of the thumb, side of the thumb, web space. Side of the finger, top of the finger, side of the finger, web space. Side of the finger, top of the finger, side of the finger, web space. And we continue going. And you're all done. Okay, now I'm done with that. So now I dress my wrist down to my elbow. Start over here. thing on this side. Okay, I get to drop that in the sink. Palms are still facing me, and now I'm going to rinse. Palm facing up. Going through slowly. Now I'm going up so that I can get the soap to go down and into the sink. We never go back. Why do we not go back? Contamination, right. So if I have to do this 2 or 3 times, I can, but it's okay if you have a little bit of soap on you, not too much. All right, so that's good. I'm gonna let myself drip a little bit. Now I need you to assist me. I need it to hang down just a little bit longer. Here we go. There you go. Grab the top part. Towards the middle on this side. I need it the long way. There you go. Yes, perfect. Now slap it in my hand. Slap it hard. Good. Good. All right. Then I'm going to bend over and I'm going to dry. Getting my web spaces real good. Each finger. Okay. I'm going up with my hand. I'm just kind of patting dry. Try not to let the towel touch me. Then I'm going to take my other hand from underneath and dry this side. And then we get to drop. So now I keep my hands up. So now please. Thank you. Great. And then you can turn the water off. Thank you, ma'am. Okay. And good. All right. So I would open up at this point because we don't want to contaminate. All right. And so it's really important because once you take it out, this is actually considered sterile. I could actually put instruments inside here. Okay. So even though I'm on this table, I would be, excuse me, at a mail stand. So I'm going to push the flat back here because I want to try to make sure that it doesn't come back over. And what's important, because I have a surgical aseptic hand wash, I do not want to touch the inside. So I just want to make sure that I put my fingers under the flap here, don't touch the glove, and then open this up and kind of bend this back. Now the nice thing is it has the size, but it also has what? Right and left. What's important is that you need to, if you are right-handed, can you do me a favor and just remove my goggles? It might be a little easier. Thank you. What you want to make sure is that if you are right-handed, you're going to start with your left hand. So when we pick up the surgical glove, we need to pick it up with our thumb and index finger. So I'm going to pick up the glove with my thumb and index finger of my right glove, I'm sorry. And I'm just going to touch the outer portion, the top portion here, okay? Because the glove is turned inside out, I can touch this portion with my hand, but once I put the glove on, I can touch glove to glove. If the glove does not go on properly, you do not adjust it then. You wait till both gloves are on and then you adjust. So now I'm just going to put my hand in here in the same direction. Okay. And I haven't contaminated. And now, excuse me, I'm going to take my right hand and I can touch glove to glove, but I cannot touch anything else. So I'm just going to slide my fingers under here as best I can. And I contaminated, so I should have not, I would have to stop and start all over again, or at least change gloves because I touched the outside there. And this is moving like crazy because I'm on a different surface. So what I want to do is put my 4 fingers in here and kind of drop it down a little bit because I want all the control of the glove. Okay, so I want to drop it down as best I can. Now I'm going to put my left hand in, and it went on okay. I usually like when it doesn't so that I can show you how it adjusts. So now I can adjust glove to glove. Okay, And we usually wear, you would wear one pair of gloves. If I was doing a procedure, I'd wear two, just in case I break a glove. I want to keep on with my procedure. Because this is folded inside out, I'm going to go here and then just pull that down, okay? But you want to be very careful again that you're not contaminating. Like you saw me touch the outside, I would get a new pair of gloves just to make sure that I'm doing it correctly. And then I would be ready, okay? Now that's if I just had this on, okay?